Welcome to all my dear student. This class I am going to discuss with you about antimicrobial agent. Let's see what is meant by what are antimicrobial agents. So these are the chemicals and their preparation which help in reducing or preventing infections due to microbes. Specific terminology describe exact mode or mechanism of action. So next class will see about mechanism of action. Before that we'll see about what are antimicrobial agent and classification of antimicrobial agents. So what is mean by antiseptic? So these are the substance that are able to kill or prevent the growth of microorganism. This term is specific for preparation which are to be applied to living tissue. So antiseptic is nothing but which are able to kill or prevent the either kill or prevent the growth of microorganism. This can be applied for living tissue, and antiseptic agents oppose the how it act on our skin. So antiseptic agents oppose the sepsis or putrefaction or decay the damaged or exposed tissue by inhibiting microbial multiplication. Thereby how the antiseptic which will kill or which will prevent the multiple microbial growth or metabolic activities which prevent the metabolic activities or by killing the pathogenic microorganism. An ideal antiseptic should destroy bacteria, spores, fungi and viruses and other infective agents without causing any harm to the tissues of the host. So they can be applied to almost all tissues of the body and may be used in the form of mouthwashes, soaps, deodorant, throat, nasal spray and vaginal touches. So these may be, so antiseptic may be applied in case of for example to be applied in the form of mouthwashes, soaps or deodorant, throat or nasal spray, vaginal touches. So in general all antiseptic are protein denaturant, that means which will prevent the or inhibit the protein cell wall synthesis or which will destroy the cell. Okay, protein denaturant and act on enzyme in the bacteria. So thus this accounts for the reduced effectiveness of most antiseptic in serum, blood or pus. Okay, so these are antiseptic. So antiseptic is nothing but these are the drugs which will mainly kill or either kill or prevent the growth of microorganism which is applied on living organism. And disinfectant nothing but these are the substance that prevent infection like same by the destruction of pathogenic microorganism. So these are generally used with reference to applied to inanimate objects. So we can understand that disinfectant differ from antiseptic. Antiseptic only applied on living organism, but disinfectant to be applied on inanimate object. So disinfectant are widely used for home or hospital sanitization purpose only. So they are bactericidal. Bactericidal differ from bacteriostatic. Static is nothing but which will prevent or arrest the growth of microorganism, but in case of bactericidal which kill these drugs which kill or destroy the microorganism and rapidly produce irreversible lethal effect. So disinfections may be accomplished by heat, irradiation or chemical. So they are non-sedative, they are non-selective, these are non-selective and destroy non-pathogens as well. So they could be applied only to inanimate objects. So all disinfectant solution undergo deteriorations under storage and elevated temperature condition. So some chemical disinfectants are too irritant and corrosive to the skin, that means somehow producing irritation and itching to the skin or tissues. Okay, so before that we discussed antiseptic. Let's see antiseptic and disinfectant. Now we may understand that antiseptic differ from disinfectant. Both are used to kill or either kill or arrest the growth of microorganism, but disinfectant to be applied on inanimate object, but antiseptic to be applied on living organism, so that so many antiseptic in the formulation of like mouthwashes, deodorant and deodorant and throat and nasal spray and vaginal touches we may use as a antiseptic formulation. Next, germicide. Germicide, the name itself which giving information. Germicidal, it's nothing but which will kill the germs. So these are the substance which kill microorganism or germs. More specific terminology like bactericidal, that means against bacteria, fungicidal against fungi, and virucide, it's nothing but against virus. Denote exact actions. Next, bacteriostatic, I already told you bacteriostatic differ from bactericidal. Cidal is nothing but which will kill or destroy the microorganism, but bacteriostatic only which will arrest or prevent the growth of microorganism. So these are the substances which primarily function by inhibiting the growth of bacteria. Thus bacteriostatic drugs or agents do not kill but arrest the growth of microorganism. Next we'll see about sanitizer. Sanitizer is nothing but these are disinfectant that are used to maintain these drugs are mainly used to reduce the microbial contaminant or disinfectant that are used to maintain general public health standards are termed as sanitizer. Sanitization is mainly concerned with cleaning or washing away the organic matter. Example, saliva or mucus. So for example, in the diagnostic center also they are using sanitizer and disinfectant, especially in hospital. They are using in germicidal agents in an anti-infective agent having power to kill the microorganism. So many agents at higher concentration are able to inhibit or exhibit germicidal activity. This concentration should not cause local cellular damage. Similarly, upon topical application, topical is nothing but on external application, if absorbed it should not give rise to systemic toxicity. Okay, so sanitizer. So that we have been discussed from the beginning what are antimicrobial agent. Then we discussed about antiseptic, disinfectant, germicide, bacteriostatic and sanitizer. These are the classification comes under from the antimicrobial agent. So antimicrobial agent, so overall that antimicrobial agent should possesses the following, that means following characteristic. So it possesses the antiseptic or germicidal activity and not bacteriostatic activity. If the microorganism do not get killed, so they may resume growth and bring about infection. So here so we have to kill the microorganism. Suppose if we doesn't kill the microorganism, mean again they may resume growth and bring about infection. So it should have rapid onset and sustained activity. So this will able to reduce the incidence of resistance. It must possesses good therapeutic index indicating usefulness in the concentration employed. It should not cause local cellular damage. It should not interfere with the body defenses. It should show no systemic toxicity from topical application. It should have in general broad spectrum of activity against bacteria, fungi, protozoa, virus, etc. So the topical antimicrobial agent should have favorable lipid water distribution coefficient so that its effectiveness has been best. Okay, so these are so far we have been discussed with that what are antimicrobial agent and their classification. From next class we'll see about the mechanism of action of antimicrobial agent. Thank you.